Good day, everyone. I'm John Allen Ambistaho from BSN 1C Group 2, and today we're going to perform a return demonstration on assessing the nose, mouth, and neck. So, this assessment is very vital in assessing or checking the status or health status or the condition of the patient's nose, mouth, and neck. So, let's start. So, moving on to the preparatory phase, first is you're going to reassess the patient's previous medical records if there are any available. Then you're going to determine the scope of assessment and prepare the equipments that are needed. So here are my equipment. We have the gloves, the improvised tongue depressor, the pen light, and the stethoscope, as well as a glass of water for later in checking the throat. So next, you're going to assemble the equipment. So here are the equipments, and you're going to perform hand washing to remove or to avoid the spread of microorganisms, and don gloves if necessary. So here I have an alcohol-based hand rub. So I'm going to use it. Next is you're going to introduce yourself to the client and verify the client's identity. So, good day, sir. I'm your student nurse for today, and I want to ask your name, sir. What is your name, sir?
John Mark Nakapatane.
Your age,
15.
your birthday,
June 25.
your religion.
Roman Catholic.
Okay. So next is you're going to explain the procedure to the client. So today, sir, we're going to assess your nose, your mouth, and your neck. So I'm going to we're going to check each portion of what I've mentioned. So is it okay for you, sir, if later on I will be touching your face, your nose, or your neck?
Yes, nurse.
Okay. So you're going to position the patient comfortably and provide the patient's privacy. Okay lang ba kasi maging koran, sir?
Yes, nurse.
Comfortably lang ka?
Yes.
Okay. So before we start, do you have any concerns, any queries, or questions? Kasi gusto ka manghihi pa, sir. Okay, good lang, sir. Diretso na to, sir. Shall we proceed? Okay. Moving on to the assessment phase in cyanosis. So first you're going to inspect the frontal cyanosis and the maxillary cyanosis, which is below the eyes, and the frontal cyanosis is above the eyes. So, so we're going to inspect your frontal and maxillary cyanosis, sir. Steady lang, sir. Okay. Next, I'm going to palpate your frontal cyanosis to check for any tenderness. Okay? Okay lang i-touch na ako po, sir?
Yes, nurse.
Okay. Okay. Then next, I'm going to palpate your maxillary cyanosis, which is below your eye, to check also or to note also for tenderness. Okay? Okay. Then I'm going to percuss your frontal cyanosis. Okay. Then also, I'm going to percuss your maxillary cyanosis. Okay. Then moving on to the nose. So you're going to inspect the patient's nose for symmetry, size, and shape. Okay, sir, I want you to study lang, sir. Kita na natin imong nose. Okay. Then I want you to tilt your head back, sir, so that we can check your nasal mucosa. So here we have improvised pen light to check the patient's nasal mucosa. So mag-tilt lang ta sa atong back, sir, sa head na to, sir. Sige, sir, hangad, sir. Okay. Then for testing for the olfactory nerve, I want you to occlude one nostril while checking for patency as you inhale and exhale. Okay, sir, I want you to occlude your one nostril. So mag-una to sa imong left. Sige, sir, inhale, exhale. Inhale, exhale. So on the other side na po, sir, nostril. Okay? Inhale, exhale. Okay? Yes, sir. Then moving on to the mouth, which is the external structure, tongue and throat. So we're going to inspect the mouth for color, odor, and lesions, as well as the condition. So before doing that, we're going to don our gloves. So we're going to inspect your mouth, sir. I want you to open your mouth. Okay, close. Then I want you to open and close your mouth again as I tell you, so that we can note for occlusion the number and the color and the condition of your teeth. Okay, sir, open your mouth. Okay, close. Then next, we're going to inspect for the nasal mucosa. We're going to inspect for color, condition, and lesions of mucosa. And we're going to note the condition of your gingiva, which is your gums, for retraction, bleeding, or hypertrophy, okay? So I want you to open your mouth, sir. Okay. Okay. Okay, wait lang, sir, ha? Okay, sa ubos. Okay, very good. Close. Then in assessing for salivary duct, we're going to inspect the inner aspect of the patient's cheek, which is the buccal mucosa. Okay, sir, open your mouth again. Then the opposite side. Okay, close. Then in Wharton's duct, we're going to instruct the patient to lift his tongue. So I want you to lift your tongue, sir, taas, so that you can see, you can inspect the lower portion of your mouth. Okay, close. Very good. Then moving on in assessing the throat and the tongue, first we're going to inspect for color, lesion, moisture, and mobility of the tongue. So I want you to open your mouth again, sir, so that we can check your tongue. So move your tongue to the left, sir. To the right. Okay. Then close your mouth. Then we're going to inspect the oropharynx for color, lesions, or drainage. And by that, we're going to instruct the patient to open his mouth and pull out his tongue. Okay, sir, I want you to open your mouth and pull out your tongue. Gawa, sir, ato tongue. Okay. Okay, close. Very good. Then we're going to locate tonsils posterior to the arches on sides of throat, and note for color, size, and presence of exudates if there are any. So I want you to open your mouth again, sir. Open your mouth, sir. Okay, very good. Close. Then moving on, we're going to test for the glossopharyngeal nerve and vagus nerve. So we're going to have the patient say ah and note for symmetrical rise of the uvula. So I want you to open your mouth again, sir, and you're going to say ah. Ah. Again, sir. Ah. Ah. Okay, very good. Close, sir. Then I'm going to lightly palpate your lips for consistency and tenderness. Okay? Sige, sir. Then I want you to stick out your tongue a little bit so that I can also lightly palpate it for consistency and tenderness. Okay, open your mouth, sir. Gawas ang atong tongue gamay. Okay. Okay, very good. Close. Then moving on in assessing the glands. So we're going to remove our gloves. So don't offer gloves. So, moving on to the assessing of glands, which is the parotid glands, the submandibular glands, and the sublingual glands. So first, we're going to palpate the front ears of the... So first, we're going to palpate in the front of the ears of the patient the parotid glands. Okay. Then we're going to palpate under the mandible, submandibular, and sublingual glands and to check for tenderness. Okay. Okay. Okay, moving on to the neck and thyroid, we're going to inspect the alignment of the neck in neutral position. Okay. Then we're going to instruct the patient to hyperextend the neck and note for bulges, lumps, or masses. So I want you to hyperextend your neck, sir. Hangad lang, sir. Okay. Okay, balik na, sir. Very good. Then, I want you to drink a glass of water so that we can inspect your neck when you swallow. to see if there are any obstruction. So, kani sir, mag-inom ka sa tubig sir, tapos maingon ako sir nga, imo na dahing iswallow, okay? Sige, drink. Sige, isa din tunla sir ha. Wait sa sir. Sige sir. Tulon. Okay, very good. Pakita ko na. Then, we're going to palpate your neck lightly to check for masses and areas of tenderness, okay? Okay. Then moving on to the palpation for cervical nodes. So first, we're going to palpate the occipital node of the patient, which is at the behind the back of the head and at the base of the skull. Okay, relax now, sir. Then we're going to palpate the posterior ocular node as well, which is behind the ears. Then we're going to palpate the preauricular node. So we're going to lightly palpate in front of the ears. And I'm going to roll my finger in the front of the ear against the mandible, against the maxilla. Then I'm going to lightly palpate your tonsillar node, which is at the angle of your jaw. Then I'm going to palpate your submandibular node, which is under the mandible. Then I'm going to lightly palpate the tip of the chin, which is the submental, and I'm going to roll my fingers against the inner surface of the mandible. So I want you to tilt your head to the right, sir, lightly, okay, like that. Okay, right na sir, very good. Then we're going to lightly palpate your superficial cervical node, which is at the upper portion of the sternocleidomastoid muscle. Then I'm going to palpate the posterior cervical node. So I'm going to lightly palpate the posterior triangle behind the sternocleidomastoid muscle. Then I'm going to lightly palpate the deep cervical node, which is the sternocleidomastoid muscle. Then I'm going to lightly palpate above the clavicle, which is the supraclavicular node, which is the supraclavicular node, and as well as the intraclavicular node, which is below the clavicle. Okay, very good. Then moving on, for assessing the thyroid, so we're going to locate the thyroid isthmus of the patient, which is below the cricoid cartilage. So we're going to locate it. Okay. Then we're going to palpate the thyroid. In palpating the thyroid, there are two ways, which is the posterior approach and the anterior approach. So first, we're going to try the anterior approach. So first, you're going to palpate the right lobe. Then slide fingers to the right, gently displace trachea to the right, and palpate gland as patient swallows. So I want you to swallow, sir, when I tell you, okay? Okay, swallow, sir. Okay, very good. Then we're going to try the posterior approach. So I want you to tilt your head right to the right, sir. Gamay, ana. Then I'm going to palpate your thyroid. Sige, sir. I want you to swallow, gamay, sir. Swallow. Okay, very good. Then, next is, I'm going to instruct the patient to hold his breath to check the thyroid gland. So, okay, sir, I want you to hold your breath. I want you to hold your breath. And then I'm going to listen over the thyroid gland to check for brutes if thyroid is palpable. Sige, sir, hold your breath, sir, ha? Ayaw ginawa, sir, okay? Okay. Then moving on to the termination phase. First, you're going to review the information gathered or obtained during the assessment and discuss the findings to the patient. So you're going to present to the client the possible plans to resolve his health concern if there are any. So karon sir mag-discuss na ta sa atong findings so far from the assessment. So I want you to listen carefully, sir, ha, sa mga itong findings. So nasal mucosa, pink, which is normal. The septum is at the midline. There is no sinus tenderness, which is also normal. So in the throat or the mouth, the oral mucosa is pink. Dentition is good. And pharynx is having no exudates, which is very good. Okay, then in the neck, the trachea is at the midline. The neck is supple. The thyroid isthmus is palpable. Lobes are not felt. Then on the lymph nodes, no cervical, axillary, epitoprial, inguinal ethnopy. Okay, which is very normal. So all is normal, sir. So you are very healthy. So next is you're going to measure the client's understanding of the plan and the need for further teaching. So you're going to provide the client the opportunity to clarify or verify any of his or her concerns. So do you have any further questions, sir? Do you have any concerns? Basi na lang tayo na kanang wala nakit answer during the assessment, basi na pa kayo na felt sa imong mouth or sa imong nose. Na ba pa, sir?
Wala na, nurse.
So okay lang ka, sir, wala kay mga health concerns. Okay? So next, you're going to end the interview politely. So thank you for your cooperation, sir. We are done with our assessment. So our findings was normal as we've discussed. So thank you for your cooperation, and I hope you remain healthy and keep up your healthy lifestyle or your healthy practice, your exercise or your what you eat, because you are healthy. So thank you, sir.
Thank you, nurse.
Okay. So next is you're going to do aftercare to reduce or to avoid the spread of microorganisms. So here I have alcohol-based hand rub. And perform hand washing. So instead of performing hand washing, I'm performing hand hygiene. Then I'm going to document the findings prior to the client's record. So that's it for assessing the nose, mouth, and neck. I hope you learned something. Thank you and God bless.